My name is Kazi Zuairia, and today my topic is the intersection of PCOS, stigma, and health access in South Asia. Before moving on to the main presentation, a bit about myself. I'm currently a junior at Vikrantsa Noon School and College in Dhaka, Bangladesh. I'm a part of the national debate team, a national best speaker, and a coach of Vikrantsa Debating Club. I'm the president and founder of Onurupa, a non-profit which is working to uplift transgender voices and advocate for gender justice as well as sexual and reproductive healthcare rights in Bangladesh. I'm a student council vice president, a policy associate at Youth Policy Forum, and a writer and researcher for Girl Up Bangladesh. In this presentation, I aim to explain what PCOS is and why it matters, discuss the unique challenges related to PCOS and healthcare access for people in South Asia, and share important steps and recommendations to address these challenges. Firstly, let's discuss the background. What is PCOS? PCOS is polycystic ovary syndrome, which is a hormonal disorder characterized by irregular or absent menstrual periods, excess androgen levels, insulin resistance, and chronic low-grade inflammation, as well as polycystic ovaries being discovered upon ultrasound. It affects 8 to 13% of women globally, according to World Health Organization. Some associated risks of PCOS are infertility, metabolic syndrome, insulin resistance, type 2 diabetes, cardiovascular diseases, anxiety, and depression. Understanding PCOS. PCOS affects about 1 in 10 women globally and is one of the most common endocrine disorders in women of reproductive age. Yet it remains underdiagnosed, misunderstood, and stigmatized, especially in low and middle income countries like those in South Asia. Prevalence in South Asia can be underestimated due to the lack of screening. However, it is rampant among women of reproductive age. PCOS has both genetic and lifestyle-related triggers, with urbanization and dietary patterns increasing its prevalence among young women. Moving on to why is PCOS a global health issue? The reason PCOS is a global health issue is because it's not just limited to irregular periods, but rather it is linked to infertility, type 2 diabetes, cardiovascular diseases, and mental health conditions like depression and anxiety. It further overlaps with metabolic disorders and non-communicable disease targets of WHO's Global Action Plan. Women with PCOS are up to 3 times more likely to experience depression and anxiety, and the condition is also linked to the development of eating disorders and body dysmorphia, contributing to further health complications in the long run. PCOS-associated healthcare costs are estimated at over $8 billion annually in the US alone. This is likely to be higher around the world due to many women not being diagnosed, especially in regions like South Asia and Africa, where PCOS rates are higher than the global average, yet it is rarely reported in such regions due to late diagnosis or cultural barriers. PCOS and South Asia. The impact of PCOS in South Asia among women of reproductive age is multifold. In South Asia, cultural stigma around menstruation and fertility often prevents young women from seeking medical care. This leads to late diagnosis and unmanaged symptoms, oftentimes heightening those symptoms. Cultural barriers and menstrual taboos delay healthcare seeking behaviors among young women. These issues contribute to gender-based health inequities and hinder the attainment of sustainable development goals, particularly SDG 3, good health and well-being, and SDG 5, gender equality. PCOS management requires sustained hormonal treatment, and this is often deprioritized in patriarchal households where women's reproductive roles are emphasized above their overall health. This is also considered a cause for financial strain in rural areas of developing countries. As a result, PCOS-related health concerns are often sidelined. How do these barriers manifest? High prevalence. In India, estimated prevalence is 8 to 22% among women of reproductive age. Similar high rates are seen in Bangladesh, Pakistan, and Sri Lanka. Cultural stigma can also cause these barriers to be heightened because menstruation is a taboo topic in South Asian communities. As a result, these are oftentimes diagnosed late. Infertility due to PCOS can lead to social isolation, familial pressure, and emotional distress. Lack of awareness can also end up causing much higher barriers. Many young women and even healthcare providers dismiss symptoms as normal teenage issues. In rural areas, PCOS is rarely discussed, and girls end up only seeking care when they're facing infertility issues after marriage. Lastly, healthcare access challenges can also cause late diagnosis. Limited access to healthcare workers in rural and low-income urban areas, cost barriers for long-term management, which often include hormonal therapy, lifestyle interventions, and monitoring for metabolic complications. A lot of the times people simply cannot access these things because these are too expensive for them. Lack of integrated care that address mental health impacts alongside physical symptoms. PCOS in my life. I'm very passionate about this topic, not just because I live in South Asia and have worked on menstrual health initiatives, but also because I have PCOS myself. I've seen firsthand how lack of awareness, stigma, and limited healthcare access shape the experience of young women living with PCOS in this region. As a young woman myself with PCOS, I've shared my story to reduce stigma and encourage my peers to seek help early, and I urge you to do the same. Call to action. Policy recommendations for South Asia in order to improve these things. From a large degree of research, we have seen that a lot of the policies that are enacted for PCOs are centered around Western countries. And as a result of that, a lot of the South Asian countries are simply deprived of such care. For example, RKSK of India, which is going to target adults in healthcare, doesn't even discuss PCOs inside its policies. So, some key areas to improve treatment in South Asia. Owing to high rates of PCOM, South Asian women would benefit from earlier and more frequent clinical screening for PCOS. Standard PCOS diagnostic categories need calibration for South Asians, considering that normal weight women can also exhibit severe insulin resistance. There is a need for reform that address cultural, economic, and systematic barriers to care in South Asian communities, both regionally and within diaspora populations. National PCOS awareness campaigns need to be held regularly. These are going to be similar to cancer or diabetes drives, and they're going to involve community healthcare workers raising higher degrees of awareness. Inclusion of PCOS in public health programs. Here we can have integrated screening in primary care settings. So this can function just how anemia and diabetes checks function for young women. Subsidized diagnosis and hormonal therapy can be provided to women from lower income families. And culturally sensitive telehealth solutions can also be done. Here, we can discuss mobile clinics and telemedicine for rural women with privacy concerns. Moving on to concluding remarks. In conclusion, PCOS is a hidden yet significant global health challenge that intersects with reproductive, metabolic, and mental health rights. In South Asia, cultural stigma and healthcare access barriers amplify the burdens of PCOS. This leads to delayed diagnosis, unmanaged health risks, and psychological challenges for young women. Today, I hope you leave with these key takeaways. One, PCOS deserves more attention within global health discussions on women's health. Two, cultural stigma and misinformation can be just as much of a barrier as medical ones. And three, empowering young women through education and accessible healthcare and supportive environments can change outcomes for the way their lives are shaped. These are my references. And I'm very, very grateful to GHLC for giving me this wonderful opportunity to present my presentation. Thank you. If anyone would like to contact me, they can reach out to me via email.